This is to practice some piston breathing in a seated position. Now I am sitting on just a yoga block like this. You could modify this any way you need to, where you could be on a couple of yoga blocks, you could be on a firm chair. I'd like you to be on something somewhat firm so that you can really sense what's happening. And then once you're seated on whatever it is, whether you're sitting on a chair or a block, just play a little bit with just kind of moving your pelvis around, getting into what feels comfortable. So shift around, see if you can feel what it's like to be kind of on your sit bones. So rather than being here where it's going to be a little harder to sense, try to come right up onto your sit bones. And then we're going to try to find that three-dimensional rib breathing that you've already been practicing. And once you feel that and you know your diaphragm is coming down with every inhale, close your eyes and see if you can sense what's happening in your pelvic floor, the area between your sit bones, with every inhale. So what you want to happen is with every inhale, the pelvic floor opens and drops a little bit toward that firm surface that you're sitting on. And then as you exhale, it comes back up. Inhale, pelvic floor opens. Exhale, pelvic floor returns back to its resting position. Now, many people, even with this firm surface, have a hard time connecting with this or feeling what's happening. So a few options here of what you could try. Everything should not increase any pain, so modify this as needed, or if you're not ready to do anything this way, then just continue using your imagination and trying to connect that way. But you can take a hand and just sit on your hand on one side, seeing if you can feel your pelvic floor move down into your hand and expand and soften with every inhale. Or you could take a folded soft towel and just put that underneath you with your sit bones on either side of it. And just having that feedback, that tactile feedback there. See what you feel. Can you feel that movement with inhale? And remember, nothing is forced. It's not a push. The breathing is soft and relaxed, and you're trying to get out of your own way. Now, another option, this again is dependent on pain, and if you're able to tolerate any pressure underneath there. And if you are not, then certainly don't try this. This is like a soft, squishy ball with some of the air let out. And you could sit that kind of to one side underneath one sit bone. And then you'll be kind of off to one side. You don't have to have full weight on it. And you could use that for some feedback. See if you feel that pelvic floor moving down into that ball. Certainly if you find any areas that feel tight or a little uncomfortable, before getting off immediately, just shift around. See if you can shift around and see if by doing that and doing a little bit of breathing, does that feeling lessen? If it doesn't, then get off the ball or move it elsewhere. But just use that ball on one side and then the other. You don't need to stay here very long. And use that ball to kind of teach yourself what your pelvic floor is doing and teach it to be able to relax and move. Now this is something you can visit throughout the day. Anytime that you're sitting and you want to take a little 1-minute break to close your eyes and connect with your pelvic floor and notice what it's doing and trying to teach it to relax and move with your breath.